Hi, let's review the best things to eat after your surgery. During the first 2 weeks, we recommend that you stick to liquids or soft foods. We suggest eating foods like applesauce, scrambled eggs, mashed potatoes, creamy soups, yogurt, ice cream, smoothies, jello, pudding, and Ensure. The goal is to minimize trauma to the surgery sites from chewing and keeping bits of food from getting into the open wounds we called sockets. After 5 to 7 days, you will return to your dentist's office, and they'll show you how to use a little plastic irrigating syringe that you can use to gently flush out any food debris that may be in there. It's important to keep food out of the sockets for 4 to 6 weeks. But people get tired of eating liquids and soft, mushy foods and sometimes try to go back to eating a normal diet a little too soon. If food gets stuck in those sockets and stays there, it can cause the area to become uncomfortable and make it more likely to get infected. So when you come back to your dentist's office 5 to 7 days after the procedure, make sure you learn how to keep the sockets clean with the irrigating syringe. Think of it like this. If your child were playing in the backyard and got a scraped knee, the first thing you would do is bring them back inside and rinse the wound off to clean the dirt out of the wound. Then you tell your child not to play in the dirt anymore to keep it clean. In this case, the dirt is the food debris that accumulates after chewing. You want to rinse the debris out and try to avoid letting any more of it get stuck in the sockets. Overall, the gentler you are with your mouth, especially the surgical sites, the less discomfort you'll have and the more pleasant your recovery will be. So, what happens if you eat something too solid too soon? Your gums are trying to grow over the top of the hole, but when you bite down, the food gets pushed down into the socket. As we mentioned before, bits of food can get stuck, causing the wound to become irritated and in some cases infected. The most common reason for increased swelling and discomfort after the first 7 to 10 days is that particles of food have gotten stuck in the wound. So do your best to stick to a diet of just liquids and soft, mushy foods for as long as you can. If food does get stuck in a socket and can't be dislodged using the irrigation syringe, then contact your dentist and have him or her check this area of concern. Remember also that it is extremely important not to smoke during the healing process, as this can cause significant pain that can't be controlled with your medication. And finally, keep in mind the 3 keys to healing after an injury or surgery. Leave the area alone. Keep the area clean. Give the area time to heal. Following these simple rules will help you have the most pleasant recovery period possible.